Saturday morning, I am cardiologist on call. I get an urgent message from hospital to come and perform a catheterization on a 26-year-old man, a heavy smoker, who arrived with a heart attack. During the procedure, we discovered a complete occlusion of one artery. This artery has earned the moniker of Widowmaker. It can cause massive damage to the heart and it could lead to death. His other arteries were completely clear. When my colleague and I went over the case, the question, how so young man suffered a heart attack, came up. My fellow physicians were unanimous in thinking the reason was obvious. He was a heavy smoker. That was cause enough for coronary disease. But wouldn't that have affected all of his arteries? How was it that only one was damaged, yet the other arteries were clear? The team didn't have an answer. As the patient was recovering, I sat down to talk with him. I asked him what had happened to him 4 years ago with his wife. He looked at me with wonder and said that he and his wife were in the midst of a crisis, and it had indeed started 4 years before. It began with the couple's failed efforts to start a family during their first year of marriage. His wife's family accused him of impotence. His wife, who didn't know the semantic difference between impotence and infertility, took her family's side. This was a tremendous blow to his ego. He felt an almost complete emotional disconnection from his wife. However, the years passed and the couple had 2 children, but the emotional blockage was imprinted on his body, specifically in his left coronary artery. As a cardiologist, I have performed coronary angiography and angioplasty for many years. I speak with my patients. I look at their arteries. And so I have learned the connection between the trauma of saying goodbye to people we love and the damage of coronary arteries. I have also learned that crises involving one's mother, father, partner, uncle, or aunt will affect different arteries of their heart. 23 years of research and clinical experience have led me to the conclusion that every psychic crisis or trauma has particular correspondence in the physical body. And the energy of the soul is what creates the connection between mind and body. A psychic trauma that doesn't resolve itself will disrupt the flow of energy in our limbs and interfere with the electromagnetic field of our cells. A child whose mother is late in picking him up from kindergarten is liable to develop a fear of abandonment and death, causing tension to the left lung. Fear of being abandoned by the father, who is away on business for a few days, could lead to stress on the right lung. A child with this type of stress might start sucking his thumb to relieve the tension from the lungs. Inhibiting crying or other emotional expression of this fear puts pressure on the bronchioles, which in turn become sensitive to external irritants, such as dust or air pollution, causing allergy and could manifest as bronchial asthma. A non-sexual crisis with a partner that saps too much emotional energy from a woman could lead to cancerous growth in the right breast, while sexual crises expose the cervix to papillomavirus infection that could lead to cancerous growth of the cervix. Whereas uterine diseases are linked to crises involving motherhood and pregnancy. All this observation and much more led me to develop a diagnostic and therapeutic method I call Unified Integrative Medicine. It is based on the connection between body, mind, and soul. It mirrors the definition of health as formulated by the World Health Organization, which says that health is a state of complete physical, mental, social well-being, and not merely the absence of disease. The purpose of this therapy is to achieve the fullest state of well-being, which could be defined as a state of mind in which people feel they are capable of fulfilling their projects in life, along with feelings of love, happiness, and freedom. This medical method puts a special emphasis on the psychological aspect in medicine and on the spiritual aspect in psychology. This is the subject I would like to speak about on TED. Thank you.